Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us again. Patients are delaying their health needs due to COVID-19. Joining us this morning is Dr. Jamie Rutland to talk about a new initiative launched by Johnson & Johnson Medical Devices companies called My Health Can't Wait. Welcome to Health Professional Radio, Dr. Rutland.
Hey, thanks for having me this morning. Really appreciate being here.
Let's talk about why My Health Can't Wait.
Oh, so my name is Cedric Jamie Rutland, medical MD. I am a pulmonary, critical care, and internal medicine physician in Newport Beach, California. I have my own medical group, Rutland Medical Group, West Coast Lung, that operates out of Newport Beach, California. And I specifically see patients that have lung problems, any kind of internal medicine problem, and I focus on immunology as it pertains to the lung.
Before the COVID-19 pandemic, would you say that people coming in for routine care, follow-up care was pretty much the norm?
Yeah, it was easy. People would come in. People would always be seen by their physician. There was no issues with getting testing, obtaining certain elective procedures. All things that needed to happen, happened, so long as the person had access to healthcare. But since the pandemic, and that's what we're talking about today, we have had 2/3 of Americans that have delayed their health care due to this pandemic. And so it's more important now, more than ever, that patients get the care they need when they need it, because as you can see, this pandemic is still ongoing.
What would you say would cause a person to delay treatment, especially knowing that this pandemic could exacerbate what they already have going on? They still need the care, but I guess the fear more than anything else.
Yeah, there's a fear out there that is prevalent, actually secondary to the pandemic, because no one really knows, patients don't really know how this virus is going to affect them. And so it's delayed emergency room visits, it's delayed healthcare visits, it's delayed life-saving treatments that need to be undertaken. And that's the concern that we have. And that's why we created the myhealthcan'twait.com website for people that have questions to be able to go get their questions answered.
How do you as a physician reconcile the fact that you know the dangers of delaying essential medical care, even in a pandemic, but you also know about the data that we're getting because of the pandemic? How can you reassure your patients that you're still going to provide the care that they need and that they still should come in for the care that they need and practice guidelines?
Yeah, that's such a great question, but I think where I obtain that confidence is fully knowing that when you come into my office or to a healthcare office, or when you come in for an outpatient procedure, there's been no data that support that pandemic outbreaks have taken place because of that. So having the confidence to be able to say that to my patients and their family members and friends allows me to be able to continue to do my job well, and allows me to be able to participate in the My Health Can't Wait campaign so that patients can come in and get the care that they need.
There are patients who are saying that a simple phone call from their doctor would be just as important as a phone call or a Skype message or a telechat with a family member on special occasions, or just to say hello. Is that something that you recommend or something that you've implemented into your approach to patient care?
Oh, 100%. The survey that we performed, we saw that nearly 1 in 5 Americans say a call from their doctor would increase their confidence in in-person care. And even more than that, patients who receive that call from their doctor are nearly 20% more likely to commit to return to a surgery that's needed. Patients who are not contacted by their doctor are 40% more likely to delay their care during this COVID-19 environment. And I can tell you that personally, that is what happens. The patients that I'm in communication with are more likely to visit, and they have questions. Hey, what are we going to do in the office? The lobby was populated. The lobby is a little too, there's too many people. How are we going to get around that? So we had to change some of our rules to be able to make patients feel safe and to allow them to feel safe and comfortable so they could return to our healthcare settings in an environment that they felt was safe.
What kind of feedback have you heard from some of your colleagues as maybe they try to reach out a bit more to their patients? In Physicians Defense, you guys are absolutely covered up to the max.
Yeah, we are covered up to the max, but I think what we have to understand is we're going to have to embrace certain technologies like telehealth, because during this pandemic, it just allows patients to feel safe, and it allows us to continue to have these conversations that are absolutely necessary to be able to get patients to return back to healthcare. because, again, there are certain physicians who aren't used to this, but at least from my perspective, I will go and help my more experienced physicians who aren't necessarily used to this type of technology. So that way they can go and get a hold of their patients. And in fact, I can tell you that I've seen some of my partners' patients via telemedicine because they're not used to telemedicine, but they know that their patients need to be seen. So they will come to me in the office and say, hey, would you mind seeing this patient for me to make certain that they get certain things done? So I do think that telehealth resources is extremely important. And that is one of the concepts that we offer questions answered on in the My Health Can't Wait, on the My Health Can't Wait website.
Now, Johnson & Johnson has launched this My Health Can't Wait campaign. Talk about some of the issues that it addresses.
Yeah. So the My Health Can't Wait campaign was launched by Johnson & Johnson. And really what it's doing is it's allowing patients and caregivers to be able to get their questions answered in regards to not only pandemic safety and medical offices, but it's also allowing us to read other patient stories, allowing us to understand telehealth resources, and it's allowing us to make it easier as we ease back into quote unquote normalcy and we're able to take care of patients like we want to do.
Now, do you think that more awareness, more data being provided by this initiative about the pandemic, is that part of this initiative?
Yeah, I think it's not about data in regards specifically to the pandemic. I would always say, please refer to the specialist or your own doctor to get that specific data that you need. I would say what this data is providing us is it's providing us with information that allows patients to feel safe about being involved in their healthcare again, feeling safe about going back to their doctor's office, going to have their elective surgery that they need, going to get the care that they necessarily will need. I can tell you a story. During this pandemic, and this pandemic has been ongoing for me, and as a pulmonary and critical care doctor, yes, I'm very busy. And yes, I'm scared and trying to protect my own family from obtaining, COVID-19, SARS-CoV-2. But during this pandemic, we had a big health scare. My own wife, who wanted me to share this story, felt a lump in her breast. My wife is a young lady. She's 36. And I could have easily just said, let's wait, let's get through this pandemic and see what's going on, because she's 36 years old. But we didn't say that. I understood, because of my participation in the My Health Can't Wait campaign, that it was important for her to investigate this. It turned out to be a breast cancer, and my wife had to have a very significant surgery to be able to get through. But again, through campaigns such as My Health Can't Wait and myhealthcan'twait.com, it allowed me to feel safe about my own family going through the healthcare system and getting the appropriate care that they need to continue on and lead a healthy life.
Give us a website where we can learn more about the My Health Can't Wait campaign and more about possibly you and Johnson & Johnson.
So to learn more about the My Health Can't Wait campaign, you need to go to www.myhealthcan'twait.com. Again, this is a resource that helps people prioritize their own health. So if you go to www.myhealthcan'twait.com, you'll be able to find loads of information in regards to how to operate during this pandemic safely within the healthcare system.
Well, I appreciate you joining us here on Health Professional Radio, man. It's been a pleasure speaking with you.
Hey, thank you so much for having me. I really appreciate being here, Neil. Take care, and I'll talk to you in the future.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Jamie Rutland. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.